Welcome to HSM 411, Creativity, Innovation and Change in Health Services. Let's kick off the subject by referring to three articles. The first by Nick Black, called New Era for Health Services, will focus on systems and creativity, an essay by Nick Black. The next one is actually a PhD dissertation by Una Lee. The title is Fostering Creativity to Improve Healthcare Quality. And finally, the article by Rachel Locke and her colleagues called Unleashing the Creativity and Innovation of Our Greatest Resource, the Governmental Public Health Workforce. Nick Black gives us a bit of a historical perspective regarding some of the difficulties in health services. Going back about 30 years, Black argues that there were countervailing interests between parties, between professional groups, countered, and it has been countered quite successfully through, for example, rigorous assessment of clinical practice, more accountability. This has been part of the evidence-based practice movement, clinical guidelines, audits, surveys, and the regulation that we have, all vital. Yet, if we turn to England, as Black has, regulators say that the quality of many of the services that we provide need to improve. Productivity varies widely. We often put this down to insufficient funding, and perhaps there's truth in that. But our kind of control and our standardisation of processes may not be getting us to where we want to be, or maybe not quickly enough. The incentives, target, sanctions, and the call to act rationally may not be getting us where we want to be. Staff initiative, Black argues, has been discouraged through this approach, and intrinsic motivation, well, the word that he uses is, the term is crowded out. Black argues that health and care services need to be able to adapt to complexity, uncertainty, and the non-linearity of health services. After all, human systems are made of this. Health and care services are human, or, if you like, living systems where it's not just the components of the systems that count, but the connections between those components. We need to exploit, he says, the resourcefulness of staff. For that, we need systems leaders, people who can recognise problems, that not just solve them themselves, but by building relationships and focusing those relationships on the problems. Leaders must encourage and allow creativity to emerge. Now, that's interesting. Rather than force creativity, allow it to emerge. What might be the benefit of this? Well, if we go now to Lee and her doctoral dissertation, she looked at, I'm just reading from her abstract, 220 improvement ideas that were generated over 18 months in health services, and she analysed the experiences of over 2,201 patients. What did she find? Creative ideas are positively associated with better patient care experiences. But there's a catch. Such ideas are less likely to be implemented. So great ideas that can be shown to work are less likely to be implemented. Now, there are, according to Lee, three kind of characteristics that relate to this. more collaborative relationships, longer organisational tenure and higher network centrality, that is, the more central one is in terms of position in the organisation, will lead to an increase in the likelihood of staff's creative ideas being implemented. Now, makes you think, of course, going now to Locke and her colleagues, what's happening? Don't we consider creativity to be important? If it is important, do we value it? How do we value it? How is that represented? Now, Locke surveyed over 47,000 staff members. What was their result? Fewer than half of all workers, regardless of demographic group and work setting, reported that creativity and, in this case, innovation also were rewarded in their workplace. So this is the background of the subject, HSM 411, health, creativity, innovation and change in health services. So we can do better. How should we start? What ground should we cover? So this brings us to the objectives for the subject. I'll go through them now. To be able to describe and compare different conceptualizations of creativity and also innovation and change and the relationships between these. To analyse health services as sites of creativity, innovation and change. To be able to critically evaluate illustrations of creativity, innovation and change in regard to, in this case, your health services. To be able to discuss manager and staff agency roles in relation to the judicious facilitation of creativity, innovation and change. To be able to explain how creativity, innovation and change can be facilitated in health services. And also to be able to look at this from a research perspective. My name is John Ray and I very much look forward to working with you this session.